Hello everyone, welcome back to Medicine Essence. Rikta this side. So as you already know that our infection session is going, before starting this today's sessions, we will briefly summarize what we have discussed so far. So I took total 2 class till now. In first class, we have discussed regarding the infections, its definitions and the basic terminologies, important and basic terminologies. Then we took the second classes where we have discussed regarding the classification of infections, and we discussed all classifications in details like primary class infections, secondary infections, super infections, reinfections, healthcare associated infections, opportunistic infections, iatrogenic infections, atypical infections, subclinical infections, and latent infections. Okay, and we took few MCQ to assess our knowledge. So in today's class, we will be discussing another one important and small topic that you can see on screen, that is stages of illness. Okay, so you might not be knowing that every infections, when it enters, it takes some times. Okay, no infection doesn't just appear suddenly. It follows a specific pattern or timeline inside our body. Like once the pathogen enters in our body, then it will take some times, then sign and symptoms will appear, then slowly it will reach to its peak level. Persons may feel sick, not feeling good, and then slowly he or she will recover from this infection. So this specific pattern will be followed by all kind of infections. So today we will be discussing all those specific pattern or stages of infections. Like here I have enlisted total 5 stages, and that will be followed by all infections like incubation period, then coming to the second stage, that is prodromal period, then the third stage is period of illness, then fourth stage is period of decline, and the fifth stage is period of decline, and the fourth stage, final stage, is your period of convalescence. So that 5 stages will be followed by all infections. Okay, these 5 will be coming under the stages of infections. Now we will be discussing one by one of these all stages. So the first stage is, as I told you, incubation period. Now what is incubation period? Incubation period is that it is a time durations. It is the time between entry of pathogen and appearance of first symptoms. Okay, so whenever any pathogens, disease causing pathogens enter to our body, it takes some times to appear the first symptoms. That time duration is called incubation period. Now different disease or different infections is having different time durations, different incubation period. In this incubation period, the susceptible host, okay, the persons may not show any symptoms, because at this time the virus is multiplying, or the bacteria or the fungi or the parasites, all those microorganisms which will be causing the infections is getting multiplied inside our body. That's why the persons may not showing any symptoms. Okay, but infections is multiplying inside. This is the characteristics of this first stage of infections. That means incubation period. So what is incubation period? Incubation period is that time duration, time between entry of pathogen and appearance of the first symptoms. That is the incubation period. In this incubation period, the susceptible host or the infected persons won't be showing any symptoms, because at this time microorganism increasing its number, okay, making the colony. Then it will damage the surrounding tissue, then it will be showing the symptoms. One by one sign and symptoms will be appearing. Okay, let's give an examples of COVID-19. This COVID-19, when the coronavirus will enter our body, it will take at least 2 to 14 days to show its sign and symptoms. So what is the incubation period for this COVID-19? Incubation period is 2 to 14 days. Another example is like measles. Measles, as I told, all infection is having different incubation period. For measles, it is approximately 10 days. Okay, this incubation period. So different infection is having different incubation period. So during this incubation period, okay, patient won't be showing any sign and symptoms. So you have to remember this. Then coming to the if I give this incubation period of this COVID-19. So as I told, for COVID-19, during this incubation period, it is approximately or average 5 days. On an average it is 5 days, but it takes 2 to 14 days to show its sign and symptoms. Okay, in this time virus enters through the mouth or noses, and it will enter or reach to the respiratory tract. Then silently it's getting multiplied. At this time patients won't be showing any sign and symptoms. No symptoms will be arise in this incubatory phase. Okay, this is the first stage of stages of illness. Okay, now coming to the second stage. What is the second stage? The second stage is here the prodromal period. Okay, so in prodromal period, This is the second step of stages of illness. Okay, so what's happened in this prodromal period? Prodromal period, this is early and mild symptoms appear. Okay, mild symptoms appear in this stage, like mild fever, okay, malaise, headache, loss of smell. In case of COVID-19, these all symptoms will be showing in mild form, like mild fever, malaise, headache, loss of smell. Okay, this kind of symptoms will be showing, and the severity will be very minimal. Okay, now the person feels not well. He might complain you like, I'm not feeling good. Okay, yesterday I was okay, but from today onwards I feel like I'm having headache, my temperature is slowly increases, I am not getting my appetite is getting decreases. All those kind of complaint patients will be giving to you during this prodromal period. Okay, but patients will be saying ki I am not feeling well, but still you can't recognize by getting all kinds of complaints, because those are non-specific symptoms. Mild fever can occur in various infections. So if a patient is saying I'm having mild fever, you can't recognize which kind of infections the person is suffering with. So but cannot identify, okay, identify the disease yet. Okay, and another more important thing you need to remember, this is the phase of maximum infectivity. Sometimes MCQ came like, which stage of illness is having maximum infectivity. Okay, so this stage is having the maximum infectivity. Okay, it is the stage of maximum infectivity in many diseases. So in case of COVID-19, okay, if a person is suffering with coronavirus, then what kind of complaints patients will be giving to you during this prodromal period? Patients will be saying I am having mild fever. Examples of COVID-19. Okay, COVID-19 patients will be giving I am having mild fever. Okay, I feel like I'm too tired. Okay, sore throat. Patients will be saying I am having this sore throat. I am having body ache. Okay, loss of smell, taste as well. Okay, this kind of complaint patients will be giving to you. So this is the second stage of period of illness, stages of illness, that is prodromal phase. Now coming to the third stage. What is the third stage? Third stage is period of illness. So in this case, it is full development of disease symptoms. Understood? Disease symptoms. And in this stage, pathogen multiplications is at its peak level. In previous stages, it was slowly the multiplications was going, but in this case, pathogen multiplications will be at peak. All kind of sign and symptoms will be at peak level. Okay, the patient shows specific sign and symptoms. Okay, in case of prodromal period, patient was showing non-specific sign and symptoms, so you can't easily recognize during this prodromal period. But in case of period of illness, patients will be showing specific sign and symptoms, so that easily you can recognize in which kind of infection patient is suffering with. Okay, in this case, in this period of illness, immune systems actively fights the infections. So if I give the examples of COVID-19, okay, so what kind of sign and symptoms patients will be showing during this period of illness? Okay, COVID-19, at this stage, patients will be having high fever. Many of you may suffer with this COVID-19 corona. Okay, so during this period of illness, patients will be having high fever, persistent cough, severe breathing difficulty, Patients will be complaining of chest pain. Okay, low SpO2, oxygen saturations will get decreases in severe cases. So those kind of complaint patients will be giving to you. Okay, so this is the third step of stages of illness. Now coming to the fourth stage. What will be the fourth stage? Fourth stage will be period of decline. As in name itself, it is showing decline. That means getting decreases. So symptoms begin to subside. Okay. Why begin to subside? Because pathogen decreases. Because during the previous stage, patients will be complaining all these things: high fever, persistent cough, breathing difficulty. So you will give some management, right? You will give some treatment. You will provide medication. As a result, pathogen will get decreases and symptoms begin to subside, as well as your body's immunities will be having some defense mechanism that will also act so that these symptoms begin to subside. Okay, and the patient's strength starts returning. Okay, so this is the phase where patients again feel like ki energy is again coming back. All complaint patient will be saying to you. Now if I give again the examples of COVID-19, why I'm giving this COVID-19 example, so that in all stages of like incubation period, how this COVID-19 patients will be complaining. During the period of illness, prodromal phase, what kind of complaint patient will be giving, suffering with COVID-19. During the period of illness, what kind of complaint patient will be giving to you. During the period of decline phase, what kind of complaints patient will give to you, and during the convalescence stage. So that's why I gave us one infections example in all cases. Now, if a patient suffering from this COVID-19 during this period of decline, patient's symptoms starts improving. Okay, starts improving, fever reduces, and appetite will be returns. Then coming to the fifth stage and the last stage. Okay, so in this last stage, that will be the convalescence. Okay, so the last stage will be convalescence. Convalescence stage. Okay, so what happened in this stage? Here patients will be, it is the recovery phase. Okay, recovery phase. The body repairs, tissue regains strength, and immunity develops. Okay, so these all are the stages of infection. So what we have discussed regarding the first stages, that is the incubation period. So what is incubation period? Incubation period means the time duration. It is a time between entry of a pathogen and appearance of the symptoms. Okay, so in this phase, patients won't be showing any symptoms, as because infections is multiplying inside. It is not reaching to a state where patients will be showing sign and symptoms. So that's why it won't show any sign and symptoms. So I gave one examples of COVID-19. It took approximately on an average 5 days, and the range is 2 to 14 days for the incubation period for COVID-19. Okay, now coming to the second phase of stages of illness, that is the prodromal period. What is prodromal period? This is early or mild. All sign and symptoms will be in mild. Severity will be mild, like mild fever, malaise, headache, loss of smell, mild cough will be there. This is in case of prodromal period. In period of illness, here everything, all sign and symptoms will be at its peak level, like high fever, persistent cough, breathing difficulty, chest pain, low saturations, all will be at its peak level. Okay, now coming to the period of decline. Here slowly all sign and symptoms will get decreases. Patients will feel that his conditions is getting improved. Okay, fever gets reduces, appetite again returns, and the last stage is convalescence stage. Here this is the recovery phase. Here body tissue again repairs, immunity again remain. So that's all about today's discussions. Now solve some MCQs so that we can assess our knowledge and get some idea how to answer questions if this concept coming from this topic. Okay, now the question is, if a MCQ came like the characteristics, question will be like, during which stage does the virus count start to decreases and symptoms begin to subside? And your option: period of illness, incubation period, period of decline, convalescence. So what will be the answer according to you? Here they are saying, during which stage does the virus count start to decreases? Decreases means decline, and begin subsided. So in which phase we have discussed these symptoms will get subsided? Here in period of decline. Okay, patients feel that his conditions regain to a normal state. So here the answer will be period of decline. Why answer convalescence is not the answer? Because convalescence means patients fully recovered, but here in questions they are mentioning about start to decreases. Start to decreases means it will be in period of decline. Why answer is not incubation period? Because incubation period is the time duration between entry of microorganism and showing the first symptom. So this is the first stage and it won't be the answer. Why period of illness is not the answer? Because period of illness at this stage all sign and symptoms will be at peak level, all will be aggravated. But here in this case virus count start to decrease. That means patient start feeling that condition is getting improved. So that's why answer is period of decline. Now coming to another MCQ is the stage where the patient recovers and gains lifelong immunity. So your option: prodromal period, incubation period, period of illness, convalescence period. So what will be the answer according to you? According to me, I will answer this is the convalescence period. Why? Because here the patient recovers and patient gains lifelong immunity after getting an infection. So at the last stage, patients will recover. This is the recovery phase. Convalescence stage is a recovery phase. Here body tissue will get repaired, regains the strength, and immunity develops. So the answer will be convalescence period. Okay. Now the last MCQ of today's class is that which of the following stages is most infectious? Okay, and your option is incubation, option B prodromal, option C illness, option D convalescence. So what will be the answer according to you? As here they mention most infectious, so according to me, answer in prodromal phase, this is the maximum infectivity. Here patients will be showing maximum infectivity. Patients will complain not well because at that time patients won't be you won't be confirmed yet that in which kind of infection patient is suffering with, which kind of specific infections patients will be having, as because there will be no specific sign and symptoms in this stage. All kind of mild fever is a very common symptoms in many infections. That's why you can't recognize by getting this non-specific sign and symptoms, although this is the most infective stage among these all stages. So that's why answer will be here prodromal phase. I hope this class is useful for you all. In this next sessions we'll be discussing about the chain of infections. Thank you.